Hi, everyone. Welcome back to Family in Focus. The show's brought to you every Monday by the Asian Community Development Council right here on PHLV Radio. Thank you so much for joining us today. We're getting into, the first month of the year. A lot of people are, still adjusting to the challenges of last year and now, lots of things to think about. And I think one of the key things that we want to bring up is not just your physical health for the new year, right? To be the healthiest for the new year, but also your mental health as well. So we're going to touch on that mental health and the Asian American Pacific Islander community. A lot of things happening in the world right now. I think it's so important to do this outreach and reach out to this community, which is kind of known for not reaching out for help when it comes to mental health issues. So I think this is a very important topic to touch on today. I have a number of guests to join us today. We have first Susan Lewis. She is a board certified nurse practitioner who's practicing right here in the Valley. So we're going to talk to her about this issue, which she knows a lot about. She specializes in mental health. And also a little bit later on in the show, we're going to bring on ACDC's Family Services Director, Vi Solano, who's also joining us on this Monday to talk about another very important topic, which is open enrollment, which is wrapping up now in just a few days. So we have, we're going to touch on all topics of health, but let's start with mental health. And Susan Lewis, we invited you on today because you are specializing in this. And it's just been, as you know, this past week has just been, just from the pandemic and then everything that happened in Washington, people are watching all these things that are very triggering, right? And when it comes to mental health, I think one of the things that I want you to touch on first is just you're feeling this. You've been doing this for a long time. Just talk to me about what's going on in the world. I mean, this is kind of a tough time for a lot of people, right?
Right. As it relates to mental health or just in general?
Just in mental health, I think, when
Okay.
it comes to like pandemic and just, politics, the election that wrapped up, I think people just have
Yeah.
so much going on. And this kind of affects your mental health. Even when you feel healthy in general, I think people are stressed, right? And a lot of things that are going on in their lives. And I think that kind of really impact your health as well.
So a lot of people will just go straight to the big
Mm,
guns, which is COVID,
right.
stigma,
Yeah.
politics, and then racism, huge issues right now.
Yeah.
But from my perspective as a provider, it's actually, I think big issues as far as pertaining to mental health are actually different.
Mm,
So I would say the immature online culture is a big hit for mental health. Access to healthcare and the delivery of healthcare services is a big problem for mental health.
mm,
And then to wrap up a lot of the political issues would be creating this mob mentality or this us versus them.
mhm,
And when it relates back to the Asian American community, I would say that, our president who has made China such an enemy and such a
mm.
bad place, most people can't differentiate. I know this is but most people can't differentiate different Asian groups.
Right. So you're
So
turning to like discrimination and racism, that kind of, part of the issue that we're dealing with here, which I
yeah,
know when we're talking about mental health, I think this is the statistic that really got to me that I found recently. It said that AAPIs are 3 times less likely to seek mental health compared to white Americans here in the US. From your experience working in this field, is that what you see, that fewer Asian Americans are reaching out when they feel like they're dealing with mental health issues?
yes, I do have over the last 4.5 years, and when I worked in the ER and psych, significantly less.
What's going on there?
Asians.
Is it the stigma? Is it just our culture that we're not used to kind of feeling like it's okay to reach out for help?
I think it's twofold. I think that the Asian American community is actually more of a community. So I want to say that, hey, you have more support, you have a bigger family group, you have groups like this, right? On the other hand, they deal with the stigma part. So it's both of those. Like, I don't know why they're coming in, why they're not coming in, and that might be, it could be one or the other, and or they don't have the right healthcare insurance that provides it, and they can't afford it. I mean, there's so many reasons why Asian Americans can be showing up in higher numbers, but as a
Yeah.
percentage of the population, I mean, we're so much our percentage of the population is so much less as well. So
yeah. And tell me what's happening. I mean, what, people feel like, what are some of the things you look for that people can think, hey, maybe I'm dealing with something that I need to reach out to an expert, especially with everything that's happening from COVID to, family issues because of politics or things like that. What are some of the things that you recommend people kind of look out for in what's happening kind of to themselves physically before that they need to reach out for help?
So being anxious, being depressed, we all have our like moments, but when it becomes disabling, like it impacts your ability to work, it impacts your ability to have relationships. Like you notice yourself isolating because you don't want people to see how you are, or you just can't stand people right now. All that is not normal. Like you're heading down a very dark tunnel. And if you don't realize, like once you enter that tunnel and you've these like warning signs, not just I was really sad, yesterday and I cried all day, and maybe over a breakup, those are big triggers, and you might be sad for a period of time. But once you start doing those behaviors that are like can't get out of bed, and it's been 2 weeks, and or just some people just have those thoughts of suicide. You have any of that, that means you need mental health services. And I would like for people to get those services before they end up in an ER, because, you know what I mean? Before we have to put you on a legal hold. So,
and you're talking about suicide, which another statistic I found is that in 2016 in CDC, according to the Centers for Disease Control, they say that half of all suicides in the US are actually in Asian American Pacific Islander community, which is, now combined with the fact that they're not reaching out for help. I think there's really kind of a scary situation there.
Oh, absolutely. Any statistic is concerning. And for me, suicide in any way is concerning, especially that I worked in the ER for 6 years and I did acute psychiatry for 6 years. You don't see the people who just have suicidal ideation. So they just say, I'm having suicidal thoughts. People who are successful usually don't tell people around them. They usually are good at hiding it. They come up with a full-blown plan and you won't even know. So the successful suicide attempts are typically harder to notice. If someone outright says, I'm gonna commit suicide, like we have to respond to that. Even if, this is what I tell people, even if you're joking, because on social media, I don't know if you know, but people say, oh, I'm gonna kill myself. They say that very casually now, like it's not a big deal. And for me, I'm like, don't say that, I have to put you on a legal hold now. You know what I mean?
Yeah.
So it's just, and then with YouTube, remember when, one of those guys, they filmed the suicide, like forest or whatever in Japan. It brings to light, like suicide is a real thing. And youth are casually saying, oh, I'm just going to kill myself. And that's really concerning for me.
And I think that's the statistics that we've been seeing too, is that more and more young people are committing suicides. We're seeing kids, teenagers, sometimes younger than teenagers. I mean, what's happening there? I have a feeling social media has a lot to do with that, right?
Oh yeah, that's that immature online culture I was talking about. And my daughter my daughter's 18 now. So I would say at least once a year, she went to a funeral for one of the kids at her school that committed suicide. Wow. It's really sad. It impacts everyone around them. And there's no one to like turn to. Not everyone has a therapist. Not everyone has parents that they can speak to about these issues that are really concerning, or like, how could it have happened to me?
Yeah.
A big,
so what do you do? I mean,
problem.
You're a parent, and I think, there are parents listening right now who want to help. And I know with teenagers, it can be really difficult to get them help, maybe get them to an expert or even just talk to them. What's your advice for parents listening out there and hearing these concerning statistics?
So you have got to create a functional communication system. It being like you guys can talk about things and dialogue, be more factual about it instead of like emotional and intense and very opinionated and this us versus them. Like this is happening everywhere. But I want to give you just one example. My daughter also told me years and years ago, Mom, I know 5 of my friends that have already been raped, and none of these girls have told their parents. They've all like will self-harm. They have eating disorders. And it's really, really unfortunate that you have this trauma, you have no one to talk to about it, and you start doing things for yourself. So you feel in control of your life, and this is what they're doing. So they take over the way that they eat or whatever. They hurt themselves, but they hide it. These are all people that are hiding. So what I want parents to do is, even if your kids don't come to you and outright say, hey, I was raped, because that's just like a big, big like deal. Like we got to call the police and we got to do a rape test kit. Notice those other signs like eating disorders, self-harm, gosh, it's
something off.
really
I mean,
hard to have so
I think
much
kind of
information.
just like trust your intuition too, right? Because sometimes something is wrong with your child, and that they need, maybe something's different. Like they're not talking to you, they're not communicating as usual, like things that you mentioned earlier about, maybe something is happening with you and you just can't get out of that dark feeling.
And if you know your kid, then you know what their normal baseline is. Right. So everyone's normal baseline is a little bit different. If you're extremely hard on your kid and you don't let them make mistakes or let them be vulnerable at times, then they're never going to open up to you. They're never going to open up to you. So you have to let them be vulnerable with you without you condemning them. Like, oh, I'm really sad because of X, Y, Z. Well, you need to, stop pouting or whatever. Those are things that will prevent your kids from ever coming to you to communicate. They'll be like, okay, I'll never tell you again. What I'll do is I'm going to go on TikTok and find other people that have my crappy situation and see how they're coping with it. And it's not always a good solution, but everyone who typically doesn't have someone close to them that they can speak to, whether it's a friend or anyone else, they will go to social media for solutions. So be aware of that.
Yeah. And, I'm just seeing this thing pop up on my computer of how Nevada has, when talking about COVID, and maybe switching gear a little bit, 2,259 new cases just in Nevada. We're talking, and, COVID is impacting a lot of people, Susan. And talk to me a little bit about that, of how even if they've not been, physically ill because of COVID, I think just kind of that uncertainty, that fear of getting the disease and all that, that's taking a toll on a lot of people, not just Asian Americans, but the community in general, right?
Well, for my patients, the only ones that specific problem is a concern is when they watch a lot of news. Outside of that, my patients who are struggling are the ones that have been isolating for so long, and they already had social anxiety. So they didn't like going out in the first place. And now they haven't been outside in months, kind of thing, or half a year. My youth are doing online school and going crazy. Parents, I have the parents of the youth that are going to school and doing online school in the home and going stir crazy. These are the everyday results of people in Nevada that are, these are actual impacts of COVID. So as long as my patients don't watch so much news, that is manageable. But then you have to get online every morning and do your online school, and you think it's a joke while you're in your pajamas and you haven't seen your friends in forever. Your kids are driving you crazy because they're home all the time and you're trying to work. Like, these are the things that are actually super stressing people out, and there's no end to it as of right now. Like, when is this going to end? Is this going to be the new norm? I go outside and I don't see anyone's faces anymore. I don't know who these people are. So
it sounds like
going to work. Like, am I going to get sick going to work? You know what I mean? Those are like everyday, super stressful, constant stressors that impact you actually on a daily basis.
So it sounds like one of the best things you can do, from what I'm hearing from you, is to maybe make that intentional effort to consume less news, right?
Oh,
Just if you
yes.
can, I think that will help, just to kind of keep, because we're just bombarded. I mean, not just like television, but social media. We wake up right away, get on Twitter, it's like, oh gosh, new cases of COVID, more people
Right.
dying. I mean, that can't be good for you.
Right. And people are drawn to negative news.
Mm-hmm.
So it has to be a very intentional thing. Like, you know what? I'm just going to watch like 10 minutes of news, or I'm going to read a few articles instead of watching the news.
Mm-hmm.
Stop seeking out things that are outside of your control. Those are all things that are not in your control. What you can do is just put your mask on, if you're sick, don't go out, kind of thing. Like, do those. Outside of that, there's nothing else you can do. It's not in your control.
Yeah.
So more news doesn't mean that you're just more aware. No, usually it's just you're more stressed out, and it's a thing you can't control. So all my patients are instructed to not watch too much news.
Good advice, I think, for all of us. If you're just watching and tuning in right now to see our show, this is we're focusing on the issue of mental health. I know a lot of people are thinking about dealing with something like this, especially with all the stressors happening in the world right now. And we have Susan Lewis. She's a board certified nurse practitioner who's joining us for this conversation. And I also have with us today Vice Alano, who is the Family Services Director at the Asian Community Development Council. And Vice, I wanted to bring you into this conversation right now because we heard Susan talk a little bit earlier about, one of the things that kind of is a barrier for people getting help when it comes to getting mental health is access to healthcare. And I know one of the things that ACDC has really been pushing on, all throughout the year is access to health insurance. And I know open enrollment is wrapping up soon. So Vice, talk to us a little bit about what you're doing right now at ACDC and trying to get people the health care that they need.
Yeah, so thank you, Patrania. So ACDC is in partnership with the Silver State Health Insurance Exchange, in which we are providing affordable health insurance plans that fits an individual's needs and budget. And it is through the Nevada Health Link. It is where you can shop, compare, and purchase your qualified health insurance plan. So at the moment, we are in the open enrollment period, which is a yearly period where individuals can enroll in a health insurance plan. It started last November 1st of 2020, and it will end on January 15th of this year. So we have 4 days left to be able to enroll in a qualified health plan. And we have state licensed health navigators at the Asian Community Development Council who speak different languages that can help you find health insurance plans that will accommodate your medical and budget needs.
Yeah, and people can contact ACDC, and what ACDC does that helps, if people don't know, is that you provide this help to help them get registered, right, for free of charge.
Yes, that is true. So we offer our services at no cost, and if you have any language barriers, we have certified enrollment counselors who can assist you with finding the right coverage for you.
And where can people reach you again, Vice, if they want to? And they can call and they can come in person. You have appointments that are available.
Yes. So since we are following the CDC guidelines and we are able to take appointments, just email us at healthcare@acdcnb.org or even at info@acdcnb.org, as well as call us at 702-772-2568 to make appointments for our certified enrollment counselors.
And I think that's what's important. We're seeing the date up there. January 15th is the last day, because that is key, right? They have to enroll. I know there's special circumstances where they can do it after that, but for most people, it's really critical to do it by January 15th.
Yes.
Yeah. And so I know you guys are available, and I know we're talking about mental health here, Vice, and I know that is covered, right, when it comes to most health insurance plans that you're seeing out there.
Yes, so many of the, actually all insurance plans under the Nevada Health Link cover mental health and substance abuse services, because these are your essential health benefits. And the plans cover behavioral health treatment, such as counseling and psychotherapy, even mental and behavioral health inpatient services, and also substance use disorder treatment that are available through the plans under the Nevada Health.
And I know, what's really key with this is the fact that they come with different price points. I know people are dealing with financial challenges right now, but I mean, that's part of it, is they're trying to make, give kind of options, right, for people when it comes to different health plans, so that they can hopefully afford what they can when it comes to health insurance.
Yes, so that is true, because it varies person to person as well as budget to budget. And then under Nevada Health Link, they have a variety of insurance carriers, such as Health Plan of Nevada, Silver Summit, Anthem, Friday Health Plans, as well as Select Plan that offers different rates. And also that's where you can choose a plan according to your needs.
All right. Well, thank you so much, Vice, for coming and joining us today, because, as Susan, who we'll bring back in here, you were talking that aside with Asian American Pacific Islander, but I think for any community listening out there, when it comes to getting help in mental health, some people may, aside from the stigma of not wanting to reach out for help, I think they feel like they can't afford it, so Susan, talk to me a little bit about, we want to bring you back in here again, a little bit about the AAPI community. And I've just kind of been reading a little bit about mental health, and I know you deal with people different ages, different community groups, but they say one of the things is, Asian Americans, they feel like, they're not reaching out for help. Part of it is the stigma, and part of it is they feel like, they don't want to be selfish. They don't want to, hey, people are dealing with, losing their jobs or income. And I'm just here just wanting, maybe someone to talk to at therapy. But you said that is so important, right? I mean, to feel like you can even function in normal life to kind of get help if you feel you need something like this.
Yes. And with those health plans that we're talking about, and being a healthcare provider, I know some of the issues between someone who's decided, you know what, I do need help, and then actually getting to somebody like me. So that's one of the big things I wanted to bring up right now, since healthcare is kind of like the wrap up topic.
Yeah.
It would be nice if we could create a list of healthcare or mental health care providers who are culturally competent in serving the Asian American community. So what happens is you finally get to that therapist to talk to, and there's a total barrier because there's no cultural competence. So, and then all of us providers have to be credentialed with every single health insurance in order to provide services to the patients. So say, for instance, I'm credentialed with HP and Sierra Health and Life, but I'm not with Silver Summit. So I think a really strong thing that we could do for the community is create a list of culturally competent therapists, psychiatrists, community organizations that if your kid went to that, or if your husband went to that they're going to get better quality treatment. And under those providers, that mental health care providers, they list the insurances that they take.
It really makes a difference, right? Not just you going to an expert or a doctor or a nurse practitioner. Sometimes it makes a big difference for someone who looks like you, right? And who just kind of share your cultural background, or maybe speak the same language. I think that helps kind of get them to open up and just even tell someone what's happening.
Absolutely.
Yeah. And Vice, and I think you see this in not just, being not in the medical field, but just to get someone to sign up for health insurance. I mean, is that what you're seeing out there? Is people maybe didn't even want to approach you if they didn't feel like they could talk to someone who can speak Tagalog or Chinese or Thai?
Yes, I completely agree with that, because you have that connection if you with someone who understands your community or belongs to your community. So that's why, because as like what Suzanne is saying, there's a cultural and language connection with that particular individual, and you understand you understand their needs, you understand, you speak the language, so you are able to communicate well with them. And I think that's where they feel they trust you more and they have confidence in you that you will take care of them.
Yeah. And what is that what you're hearing from people when, people call ACDC? And what are some of the things that they're telling you that, why they never got health insurance or sought out healthcare in the first place?
Well, mm, some say that of course it's expensive, but you just have to, or they don't need it. They're healthy. I'm young. I don't need a health insurance at this time. But of course, we try to help them understand that, for your peace of mind, if you have a health insurance, then you know that if something happens to you, especially at this time during pandemic, you know that you are covered. So we just help them understand why it is essential to have a health insurance. And of course, they also prefer someone who can speak the language, so they can so you can explain it better. Like, of course, health insurance is very, very broad and not easily understood by everybody. So by speaking your language, you are able to explain it to them well.
Yeah, no, that is true. And I think, Vice, and as Susan was saying too, I'm sure you've been in that situation where you feel like people can connect with you at a certain level better because maybe, whether they're women or they're Asian Americans or something like that. And that's why you feel like as a health provider, that's very important for you as well.
I get my patients to just vomit information because I can build rapport so fast. Like getting just to that, I've built rapport with this person and I'm going to actually start divulging quite a bit of information. That happens very quickly with me and my patients. And it does not happen a lot with other patients and providers. So having those healthcare providers that drop the wall faster is ideal, especially because access to healthcare is so expensive. So,
yeah. So bottom line, yeah. What's your best advice moving forward? 2021, as you said, still uncertain. The vaccine is, people are starting to get that. I think that's kind of the silver lining for a lot of people. It's like, hey, maybe help is we're at kind of that end of the tunnel. We're seeing the light at the end of the tunnel. What else can we do? Just bottom line, just to kind of keep healthy and staying, just positive and everything that's happening in the world.
So I want people to realize that for therapy, you can get therapy services through an app now and just pay $75. Usually, I think that's the going rate for the therapy sessions for almost an hour. You don't have to show up anywhere. You just have to stop what you're doing for about an hour to get that service.
Yeah. Vice, actually, I just saw a question that you posted here and she's talking about, do you think one of the causes for anxiety among children is the inability to interact with people their own age, right? They're not able to talk to their friends about it. Do you feel like that's one of the issues or what do you think coming from your perspective?
You mean because they're not going to school anymore? Is that the question? Oh, so I've noticed they're still interacting. It's all, a majority of it is online. And so that's where we need to have that conversation with our kids on how to use the internet and social media platforms in a good way. So they're interacting, trust me. There's still bullying going on. There's still inappropriate sexual behaviors. It's all still happening, just online. So be aware of, be aware that all kids are on social media, whether they tell you or not. So be able to have that conversation with them, like what platforms are you using? What kind of things are you posting on TikTok? Like, hey, if you're gonna have a TikTok account, can I at least see it? Hey, maybe you should do this, or those kinds of things, because they are still interacting. I think it's not the lack of interacting with their friends that's a problem. It's the always being home with their parents is a problem. So.
Yeah, it's a challenging time for so many people, but I really appreciate having both of you, Susan Lewis and Vice Solano, to talk about this. Very interesting topic. And as Susan was telling me earlier, we could talk about this for hours. There's so much to talk about, right? But I think it's good to kind of start this conversation now and for people to reach out for help if they need. Sign up for health insurance if you haven't already. I think this is an important topic to touch on as well. But thank you so much for your time and for both Susan and Vice who joining me today. And just stay healthy, stay positive, and take that advice to kind of lessen that consumption of bad news, right? Stay on the pot.
Yes.
Thank
Moderation.
you so much. Yes, thank you so much. Moderation is key for sure. Mm-hmm. All right. Thank you, Susan. Thank you, Vice. And thank you, everybody, for watching. And I'll see you on the next episode of Family in Focus.
La razón por la que me inscribo es porque mantener mi diabetes bajo control no debería controlar la forma en que vivo.
Cualquiera que sea tu razón, estamos aquí para usted.